All right. Thank you for coming
and
interviewing with me here. So why don't you tell us a little bit about yourself, what your name is, and how you would consider yourself an entrepreneur?
Well, my name is Robert Vogel. I was born in New York City. I moved to Lynchburg about 21 years ago. I came here originally after my fellowship, which is a degree in medicine. I'm a medical doctor. I did an ophthalmology residency at the University of Virginia, so I knew Central Virginia. Then did a residency at UVA, and then did a fellowship, which is an additional training in retina in Texas, and then came right here from there. So I've lived here for 21 years.
So you have your own practice here?
I do. I'm part owner of Piedmont Eye Center, which is the largest multi-specialty ophthalmology practice in Lynchburg.
Okay. So you started that practice with your own money, or you joined part of the practice originally? How long has that been a practice?
Well, it's been a practice for 30 years. I originally joined an ophthalmologist. He was a solo practitioner at that time, and if there's any entrepreneurial success that I'm most proud of, it's the success of Piedmont Eye Center, because he and I started out in a very small office. We ended up buying land right down the road. We built a building, and now we're up to 8 physicians of all different specialties, and so we've really had good market penetration. And Lynchburg was really basically sewn up by one physician at that time. The ophthalmology community was, and now we own a good market share of Lynchburg, and that's been a big entrepreneurial success for me.
Okay, so is that typically common with an eye doctor? Do you normally start your own practice, or is that kind of something that are there certain characteristics that you have that caused you to want to start your own practice over just working for a hospital?
Yeah, it's a good question. 20 years ago, most people coming out of residencies or fellowships would be going into solo practice. These days, the statistics have actually dramatically shifted. The average person coming out of residency now goes into an employment situation. So 70% literally of people leaving residencies are going into employment practice, which really doesn't fit my individual characteristics. I'm very autonomous, and I like to take risks in my life. As far as my work life goes, and so this model of going into private practice really was much more of my personality than would have been being in an employment situation.
So you mentioned that the shape of the medical field is changing a little bit. You think that is that because of government policies? Is the private sector just getting larger on its own? Why do you think that change is happening?
Various reasons, but I mean, everyone's aware of the fact that the government, has really become interventionalist in the healthcare sector. So there's been a big shift in the way hospitals have to act, which has probably been the biggest transitionary cause of that statistic changing, because hospitals are buying medical practices. For example, here in Lynchburg, Centra Health is the largest medical provider, and they own many medical practices now, and so a lot of physicians in Lynchburg now are even employees of Centra Health.
Okay, so Centra Health it's not a government-owned organization, is it?
No, it's a nonprofit.
Still a nonprofit system, but it's taking over kind of a lot of that side. So the shape of the medical field is changing a lot. Okay,
it is, and it really, those government regulations have big impact on my daily life. I mean, really. The whole shape of what Obamacare, or the Affordable Care Act, if you will, did to medical care really has changed, a lot of the way we've thought. Not only in the way things are coming out now, but the way we project them into the future. So when you're an entrepreneur or risk taker, you have to consider what is the current state of things, and then you have to make projections about how things will be a year from now, 5 years from now, 10 years from now, and then base your model on those projections.
Okay. So a lot of your business practices are based off of those projections. A lot of the decisions you've made are. Can you think of an example or any time when maybe some of those projections that you foresaw didn't come true, or maybe you made a mistake on those projections? Or?
Well, I can think of a few. First, there's an Obamacare regulation that involves whether employers have to supply medical insurance for their employees. And if you have 50 or less employees, it does not apply to you. It's called the employer mandate, famous regulation within Obamacare. And so we had to make a really a really prudent decision at one point about whether we wanted to go over 50 employees. We were right at that 50 employee mark. We were right about 48, 49 employees. And we said, do we want to, move past that? We could have kind of stayed small, or we said, oh, we're just going to push past that and then just go with the regulations. Okay. And what ended up happening, we decided to push past, and what ended up happening was that employer mandate was actually put off for now several years. So we didn't have to really deal with it, but we probably will have to deal with it in the future. Also, there was a coding mechanism called the ICD method, and we were all ready to employ it because it was going to start January of 2015, okay. And then we had sent people away to classes. We were all getting ready for it, and what ended up happening was they put that off for several years as well. So sometimes as an entrepreneur, you make, when you're dealing with the government, you make decisions, and then sometimes the government at best you can, and then the government kind of backfires on you, and just do what you best you can.
So in light of kind of the inconsistency of federal guidelines at times, would you, in your opinion, do you think that that states or governments should have a role in fostering entrepreneurialism, or is it something more for the private sector? Should you be regulated more on your own in this free market? It sounds like you have different opinions about how free of a market it really is.
Yeah. Well, I mean, personally, I think the medical care system would work better if it was more of a free market. I think the healthcare system is such a unique market. It's way different than, I'll give you an example, like LASIK surgery, which is one thing we do in our office, is much more free market driven than are any other parts of what we do, because we advertise LASIK. It's a cash business. Okay. People pay with their credit card, not through, no insurance doesn't cover it. Right. The cost of LASIK 5 to 10 years ago, whenever LASIK started, was double what it is today. Wow. Because of the free market, it's been driven down. Because of competition, the price of LASIK has been driven down. However, the cost of other medicals, we all know medical care increases at a rate that's even above inflation, right? So, so that it does not fit that much. Why is everything else increasing in price and LASIK is decreasing in price? And I think a lot of people use that as a way of showing that if we allowed free market principles into medical care, that we would probably drive down costs.
Yeah, benefit the consumer from that side.
Correct.
So that was another question: is how does inflation affect kind of the prices that you put on things? And
doesn't affect me at all. I mean, I'm paid by the government. About 60% of my work is by Medicare, which is a government, federal government. A smaller percentage of Medicaid, which is state, and then we have other insurance companies. So we negotiate not so much with the federal government, but with other carriers on the price that we get paid. Okay. That the inflationary figures and things like that would be built into those prices.
So are those fixed? Are those prices fixed for a certain amount of time, or
they're fixed for a year?
For 1 year.
For 1 year, and then we renegotiate.
Okay. So I'm not terribly familiar with the way that health plans work. I mean, wouldn't those health plans be affected by inflation? Wouldn't the prices that you initially agree upon be affected by the general inflation? Or you're saying it's not so much with your pay directly?
It's not so much with my pay directly. We get paid based on what their reimbursement, and there's a lot of things that go into those negotiations. They have to price their plans based on their pool of people who they have. Okay. The whole idea, for example, the whole idea behind Obamacare was that if they could get a healthier pool of people, young people like yourself, into the insurance pool, then that would allow those costs could be shifted to the amount you would pay would be shifted toward older people who really have much more healthcare needs. Okay. And so that pool of patients is really what insurance companies look at when they're basing their decisions on how much to allow me to make and then how much to charge the consumer. So inflation doesn't so much affect me, but market forces affect me. Because of the overall market forces affect me just because that's my reimbursement is based on market force.
Okay, gotcha. I want to shift a little bit. You mentioned a lot of the government intervention with policies and how that seems like negatively affected at least the healthcare side of what you do. So recently you have moved, or you've gone off to pursue kind of the law side, the legal side of the proceedings of the healthcare industry. Can you talk a little bit about that and what caused you to move over to that side?
Yeah, I mean, I think I'm unique. I mean, in this, well, not unique. There are other medical doctors who become lawyers, but I mean, unique in a way that, you know, I looked at the government's intervention into healthcare as being a negative. I mean, you've termed it as a negative, and there are people in this country who think it's a positive. I mean, I personally think that amount of intervention is going to lead us down a road to less autonomy for patients, and eventually shifting of, you know, to limitation of care and shifting to less healthy people, away from less healthy people to more healthy people. I don't see it as a positive.
Okay.
So in seeing that, when the Affordable Care Act was on the horizon, I decided that I wanted to go to law school.
Okay.
And so I spent the last 5 years going to Liberty Law School.
Okay.
Just graduated, and I just passed the bar. So I'm looking I'm actually looking to set up a law office now. I mean, in the terms of what we're speaking about here, I really look at law as having more, it's less interventionalist. You know, I would have direct payment from customers. You can hire and fire different customers, different than we would in medicine. There are certain, you know, legalities to taking on patients and so forth. So there's just a lot more free market principles involved in being a lawyer.
Okay.
And so that was one of the things that drew me to it, not the only thing, but I'm in the process of just starting up a new business now at my age, so I'm really kind of excited. It's going back 20 years when I started my medical practice.
Yeah. So what do you hope to accomplish with this this practice that you're setting up?
That's a good question. I mean, I really haven't completely answered that myself, but as for now, I'm going to practice law 2 days a week and practice medicine 3 days a week, and probably transition into being a lawyer full-time, depending on how things go.
Okay.
I eventually want to be a professor, a law professor, and so I'm kind of working my way toward that. But in terms of like entrepreneurial things, you know, which I think is what you're really looking for, you know, it's really been an exciting time of my life here, just finishing up law school, because I'm, you know, looking for office space and trying to position myself in the marketplace. I mean, a big thing now, I think a word that has really become really important in the whole entrepreneurial world is branding.
Okay.
And so I'm really looking at how I'm going to brand myself.
Yeah.
I mean, I have a kind of a unique situation, so my branding is going to have to do with the fact that I'm a doctor and how I'm translating that into my law practice. And so I'm working on branding, logos, you know, letterhead, I mean, all these things that entrepreneurs do. It's an exciting time.
Should helpfully give you a foot up, since you do have that medical background.
If I use it right.
And you're practicing medical law predominantly, so.
I will. I mean, it's a matter of how you position yourself. You know, I mean, you know, I mean, just to give you two ends of the spectrum, I'll tell you which one I chose. I mean, I could brand myself as a kind of let's say I want to become a plaintiff's lawyer for malpractice, right? So I'd be taking people who are trying to sue doctors. I could use my branding to be, I know more about what doctors are thinking than the average lawyer, and so you should hire me to that kind of thing. Or I could say, I'm a compassionate caregiver. I'm going to listen to you. I mean, I'm being a doctor, I have that feeling of compassion, but I'm also a competent counselor. So that's my branding is going to be compassionate care, competent counsel. That's how I've decided to brand myself as a lawyer. So, you know, there were big decisions. Yeah, thank you. All 4 C's. So I've decided to kind of brand myself in that way. And so, but you really, when you're an entrepreneur, you have to look at the marketplace and see, like in Lynchburg, you know, there are no other doctor-lawyer combinations, so I have to kind of see where do I fit into the marketplace and then kind of move myself through.
Kind of carve your own location almost, too.
My own location, my own brand, and how do people look at me, and when they open my webpage, what do they see, what do they think? You know, are they going to want me as their attorney, knowing I'm a doctor, even to do their will or to do something else, and I have to brand myself in those ways.
Branding has a lot to do with establishing your place in the market there.
Correct.
So as a lawyer, then, the legal side of things, is there anything specific that you would like to see changed, whether it's policy-wise or the way that healthcare is distributed, or I mean, is there something that you're trying to have changed, or are you just trying to practice law and kind of help as best you can?
My original idea was to